In Chapter 13, we're looking at physiological or body strategies to enhance recovery. Under the key knowledge 4.3 there, you've got the different physiological strategies that are included within the study design. You need to know or be able to describe each one. You need to be able to prescribe each one to the right athlete and explain what the expected outcome or the goal of that particular strategy is. So if we're looking at the key idea behind recovery, the main idea is that if you recover faster, then you're going to be able to perform better. With regard to competition, that's reasonably self-explanatory in that if you perform better, you're going to do better. But also in terms of training, it means that you're going to be able to give more to training and consequently you're going to be able to get more adaptation and therefore perform at a higher level each time you do perform. It aims to restore physiologically, which is our focus, and also psychologically, the performer, to pre-exercise or competition levels in the shortest time possible. So that idea of physiological restoration refers to muscles, so that muscles are not sore, muscles are not stiff. It refers to fuel stores, so that fuel stores are maximised, and hydration as well. And if the recovery process is improved, then adaptations will occur quicker and therefore you can maintain frequency and intensity of training and get more out of your training program. The two types of recovery that we've looked at so far, active and passive recovery, again, you need to be able to describe what it is. So active recovery is doing the same activity at a lower intensity, and passive recovery is rest recovery, and you need to be able to prescribe. So who would work? Who needs active recovery? Someone who has metabolic byproducts, so someone who uses the anaerobic glycolysis system for their event, maybe the aerobic system. And passive recovery, those who need fast replenishment of CP. So those sorts of events that are dominated by the ATP-CP system, such as diving, gymnastics, vault, and the field events in athletics. We also need to be able to describe it, so what actually occurs or the goal of it. We just talked about passive recovery. The goal is to replenish CP fastest. The goal with active recovery is to maintain circulation and create a muscle pump. So by your muscles contracting through exercise, it pushes on the vessels and therefore you get more blood going back to the heart. You prevent venous pooling, which is blood pooled around the extremities and can lead to swelling and discomfort. And it also removes and enhances those metabolic byproducts. The main one we're talking about there are hydrogen and lactate. So it oxidizes hydrogen at the muscle site by enhanced delivery of blood and therefore oxygen to the muscle, and it removes lactate as well and flushes that into the core part of the body for processing by the liver and also for the other muscles to take up that lactate. Now, sleep is an important one. It comes under physiological and psychological. If you look to the right there, just above the girl who's asleep, it increases cell repair. And the reason why it does that is because when we sleep, we get an increase in hormone production. And that main hormone that we talk about is human growth hormone. And that human growth hormone helps grow and repair our cells. So if our cells are repaired faster, then that is going to encourage or enhance the recovery process. I think it's important to look at the effects of lack of sleep, and most of those are more psychological. So we have decreased in focus, our ability to process information is decreased, and quite often they say that driving fatigued is like driving with a blood alcohol limit or concentration higher than 0. Our perception of fatigue, that's an important one, also increases. So we feel pain easier and we also feel tired faster. And we don't want a decreased function of our immune system when we're an athlete. We don't want to be susceptible to illness. So we need to know what it does, the benefits of it, and also the harms from a lack of sleep. That's important. Some guidelines down there for you to look at in terms of sleep and best practice. In particular, that first one, avoid anything that's a stimulant for the central nervous system. Now, hydrotherapy means use of water, and it includes the below. Now, with each of these, there's going to be different times when you're going to be able to use each of these, and also times when some of them are going to be less appropriate. So contrast water therapy is going hot to cold. We're going to look at each of these. Cold water immersion or cryotherapy, cold. Hot water immersion, hot. And pool and beach sessions, the difference between the two and which one we should use when. Also, these come into it. I mean, you're not always going to have access to a bath for cold water immersion like this, an ice bath, you might have a cold shower. So it might not always be possible to achieve each one. Likewise, after an AFL match finishes at 10:30 at night, they're not going to go down to the beach and jump in the water after that. They might do it more in the club rooms. So maybe the next day they'd go to the beach. So it's important to be realistic about what it is that you can do. So cold water immersion, or CWI, it's known as. Cryotherapy is another word. Cryotherapy can also refer to ice. So what this involves, remember we need to be able to describe it. So you immerse the body in cold water. You can use ice packs or ice baths, as you can see below. Now what this does is this shuts blood flow down. So you get vasoconstriction, which is a decrease in the vessel size or diameter, which means that the blood in the extremities is shunted back into the core part of the body. So decreases venous pooling and increases venous return and the removal of metabolic byproducts. Now, in terms of edema is that leaking of cellular fluid around an injury site. So when you get injured, particularly a soft tissue injury, you get tiny little breaks in the capillaries and the vessels surrounding that area. And that leaks blood. That's what it looks like when you get a bruise or hematoma. And you leak fluid as well, and that's what happens when you get that slight swelling. Now, if you apply ice or cold water to that, just like you apply cold water or ice to an injury, then that will decrease the blood flow to that area, and it will actually push some of that accumulated fluid back into the core part of the body, which of course is going to enhance recovery. What it also does is when you are really cold, you don't feel your skin as easy. So it may reduce the body temperature, so you can't actually feel the pain. So that could be an advantage as well, which means it might decrease recovery time. And it has psychological benefits as well. It feels pretty nice, although not at the time, but afterwards it feels pretty good to have all those metabolic byproducts flushed out. Although you can get a little bit tired, and that's because the liver is working overtime to help remove those byproducts as well. So that's cold water immersion. Really good for someone with injuries, really good if someone who's played contact sport, and they might have soft tissue bruising, really good for them. Now the beach session is where you immerse the body in cool or cold water. Quite often it's just the legs, particularly on really cold days. It's not very pleasant to get your whole body in, so legs are important, as you can see in the picture below. Again, the goals and outcomes is exactly the same as the previous cold water therapy or cryotherapy, but what happens with beach session is that the salt in the water creates a pressure on the legs, on the vessels, which is called a hydrostatic pressure, and that's greater in salt water than it is in a pool session. So that's better because that pressure is going to increase the removal of byproducts. Water immersion, also down the bottom, you can see relaxes muscles because you're not working against gravity as much, and increases buoyancy, although we're not looking at the whole body going under there. Now, hot water immersion can be really great because it enhances blood flow to an area. So that is great when you want to remove metabolic byproducts. It's great when you want to relax or when you want to stretch, because that warm environment means the muscles have an increase in elasticity. You can get greater joint range of motion and it feels really relaxing, but it's really important after a contact sport or after a sport where a soft tissue injury has occurred that this is avoided, because it does vasodilate. It does increase blood flow to areas in the peripheral legs and arms. So if you have an injury there, that will enhance swelling. So you need to avoid that in those particular cases. Likewise, you'd avoid it in contrast water therapy because it's alternating periods of hot and cold. And ideally, you'd be immersed in hot water, immersed in cold water. Not always possible, so they might use a steam room. Now, because your vessels are dilating and constricting, this is called a venous pump. So it is different from a muscle pump, although you're getting the same thing out of it at the end. But a muscle pump is where the muscles are contracting and they are forcing the vessels or pushing on the vessels, whereas a venous pump is the vessels actually decreasing in diameter and then increasing. So why this is good, because you get both of them. You get an increase in blood flow to the muscles during the periods of hot time, which increases circulation, and then you shut that blood flow down. You get vasoconstriction. You get an increase in blood flow to the core part of the body. So again, it should be avoided if people have bruising and other injuries. So something else that VCAR like to look at is compression garments. And compression garments can be worn lots of different areas. They can be worn during training. They can be worn during sleep. I know 2 times a year has come up with sleep ones, performance ones, recovery ones, prior to an event or post-event as well. So the idea behind the compression garment, and definitely the jury's out as to how successful this actually is that it's supposed to create a passive muscle pump. So by constricting or pushing on the muscles, it is supposed to decrease venous pooling and delayed onset muscle soreness. So the idea is that it's got pressure points along the seams of the pants or the top that might be worn, and those pressure points are supposed to direct blood flow back to the core part of your body to decrease, again, edema, so that's linked in with swelling and reduce damage. Now, where this is good and where compression garments came from is the idea of post-hospital, particularly for elderly people, post-operation in hospital for elderly people who weren't that mobile, compression garments on their legs to make sure that you didn't get venous pooling and so that blood flow would continue back to the core part of the body. And also during flight. So for, let's say, AFL players who are flying over to Brisbane, flying over to Perth, for example, they might use those tights if they're flying directly after a match to decrease the venous pooling in the lower part of their body. So there's definitely some advantages and clinical advantages in terms of actual recovery or in training. I mean, they're warm, they make you feel warm, and if they make you feel good, and I always say with these sorts of recovery techniques, if they make you feel good and they're not illegal, they help psychologically, then there isn't really any harm in doing it. Massage. Massage is great because it has a lot of psychological benefits. The idea behind massage is that it increases blood flow, therefore supply of oxygen and nutrients, and increases the removal of waste products to enhance recovery time. Now, massage, we're talking about pumps again, massage is a passive muscle pump. So it's not an active muscle pump because you're not contracting your muscles yourself. It's a passive muscle pump because someone else is actually pushing on your muscles, and they're pushing on your muscles to increase blood flow to that site, which increases circulation. Definitely needs to be avoided by those with soft tissue injuries. So anything that increases blood flow to a site needs to be avoided by soft tissue injuries. But it can really help with the impact of delayed onset muscle soreness. Largely, there's psychological benefits for massage, and there's different types of massage that you can have post-event. You can also have one prior to an event, but we really talk about it with regard to recovery. So lots of points. You need to know about each of those points there and who would use it and who wouldn't use it, so be able to prescribe it. Right, nearly at the end now, hyperbaric oxygen therapy. So this is a good one because you go into a little chamber and it's pressurized with 100% oxygen. Often overnight it occurs, and this is great because you are saturating the blood with oxygen. You are ensuring that your hemoglobin is compacted with oxygen. You've got more dissolved oxygen in your blood plasma, and it decreases recovery time because you get more oxygen transported to body tissues. And oxygen is something that's quite magical. It increases new vessel blood growth, which is going to be great for capillarization. Decreases the risk of swelling and also edema. That word keeps coming up. Just remember, think edema means essentially swelling due to fluid accumulation. That's what it means, really. That oxygen also helps the immune system, so decreased risk of infection, and it also enhances sleep as well. So hyperbaric chamber is used as a recovery strategy. It's important to know the difference between a hyperbaric chamber and a hypoxic tent, though, so I've just included that here. We will talk more about hypoxic tents when it comes to these ergogenic aids and linked in with altitude training. So hypo is low, remember? Hyper is high, and we're both talking about oxygen. So let's go through the right-hand side first. Hyperbaric chamber, high oxygen concentration. It's used for recovery to enhance injury repair in particular. AFL players are definite users of this particular strategy. You'll probably hear more about it in the lead up to the finals. Now, hypoxic tents, on the other hand, are definitely not used in recovery. In fact, they would be detrimental to recovery because it's essentially starving the body of oxygen, a low oxygen concentration. So this is used in training or in the lead up to an event. And the idea is that it essentially simulates an altitude training type environment. So someone can train at a lower intensity so that they're able to maintain their training intensities and perform hard, but then they can live high or live in a tent, so sleep in a tent which has low oxygen concentration. So what happens when you have low oxygen concentration is the body makes adaptations because it goes under stress, and it makes adaptations in order to cope with that stress. So not dissimilar to aerobic based training, those sorts of continuous training, fartlek training, it makes adaptations like increasing red blood cells, increased myoglobin. It makes those changes so that the body can deal better with the oxygen that it actually has available. So it's pretty awesome that the body can do this, but you don't want to train in a low oxygen environment because then you don't have the oxygen delivery to the muscles. So you can't work at a good enough intensity to actually get the change. So it's live high or sleep high in the hypoxic tent and then train at your regular environment where you've got the oxygen so that you're enabled to maintain that intensity. And cyclists certainly use it. We've got swimmers in there. Michael Phelps use it as well. So we've got a little summary. So make sure you have a look through this and make sure that you complete your chapter summary. And we will be concluding this on Monday and going on to our next chapter. Thanks, girls. Hope that helped and have a good weekend.